So I wanted to talk about neuropathy because it's coming up a lot lately. When I meet clients, when we do consultations, I've even experienced it myself, believe it or not. I do have hypothyroidism, so peripheral neuropathy can be correlated with hypothyroidism and thyroid disorders. So basically, your nervous system connects nerves all over our body, from our brain and spinal cord, our central nervous system, to the rest of your body, including our hands and our feet and our arms, and even our eyeballs have thousands of little neuron connections. And the job of these nerves is to deliver signals on what to do, what your brain would like your body to do. So when we look at peripheral neuropathy, this is a disorder that occurs when the nerves malfunction, or they're not talking or signaling properly to each other because they've been damaged or degraded or destroyed. Or sometimes when I'm describing to my clients, I talk about the neurons having a bridge and how they talk to each other across that bridge, and if the bridge breaks, then the connection is broken and the signaling doesn't get where it's supposed to, and this disrupts the nerve's normal functioning. So their signals, they might be sending signals of pain when something's not causing you pain, or where they want you to move, or whatever. Like, your neurons are connected to sending signals all over the body. And when we have this neuropathy, or we have this damage or disorder of the neurons and the neuroconnectivity, we don't get that proper signaling. And that can be due to a lot of things. Like I mentioned, we'll see a lot of neuropathy connected with hypothyroidism and thyroid dysfunction, where we might see tingling in the hands or the upper arms, the forearms, across the face, even in the eyes, even in the lips. You'll see tingling or maybe numbness. Some people will experience some sort of pain, but it's usually not a sore pain, but you'll just notice things are different. Even like a cool tingling, it can be inherited, it can be an infection, it can be an injury, it can be from a systemic illness, it can be from something like multiple sclerosis. So we see a lot of different things that can cause or be connected to neuropathy. Even malnutrition, issues with B vitamins have a big connection to neuropathy as well. So there's more than 100 different types of neuropathy, and each different type of neuropathy has its unique symptoms, but some of the ones that people notice the most are going to be the tingling and the numbness and that cool sensation. Some people will get a sensory sensation where they might get, it hurts to touch them, or they feel like they have stretched a muscle and they get that nerve pain, but it's not the case that they overtrained or anything. It's that neuropathy. Some people will get numbness again in the hands. The feet is a bit more uncommon. Usually we'll see it in the hands or the forearms. Blood pressure can have a connection to neuropathy as well as a lot of other symptoms that we would see connected to thyroid would have a connection to neuropathy. Insulin resistance and diabetes. So there is a type of neuropathy which is diabetic neuropathy, but even if someone is not diabetic, they can still have an insulin resistance correlated or connected form of neuropathy. In that sense, that's where there would need to be a real nutritional approach, looking at how insulin is timed throughout the day and stuff like that. So just because you haven't got an insulin resistance or diabetes diagnosis does not mean that there's no correlation there between your insulin and your nutrition and how it's impacting your connective tissues and your nerves. So poor nutrition, of course, is going to prevent cells and neurons and nerves from regenerating and functioning optimally. So we do need those essential fatty acids for good tissue integrity, but we also need them for the coating around the nerves and the neurons, and that's called myelin, the myelin sheath. And that is very important for protecting the nerves and helping them talk to each other properly. And when that starts to degrade, we can see an illness like multiple sclerosis. There's a huge connection between that degradation of the myelin sheath and the multiple sclerosis as well. There is also some evidence to suggest that people with thyroid disorders do have a degradation of the myelin sheath. So when we see that damage, we're looking at, well, how can we support that? Walnuts have been shown time and time again to be very beneficial for neurons and for being neuroprotective and helping the nerves regenerate and function optimally, as has extra virgin olive oil, as has dark chocolate, as has good caffeine or good coffee in context, of course. Anti-inflammatory foods, fatty acids, very, very important. But one supplement that pops up time and time and time again and has been shown to be very, very beneficial for the neurons and for helping with neuropathy is vitamin B12, and not just your generic vitamin B12 that you'd pick up in Walmart or a health food store and not actually understand what you're buying, and not necessarily like your B12 shots, although if you're going to a good naturopath or a good doctor, they should know what they're doing, but specifically the methylated form of B12, which is methylcobalamin, and there's many studies that show that doses of 500 milligrams and more can be very, very effective and supportive of neuropathy and even reverse symptoms in some of the studies. So getting a good methylcobalamin, not cyanocobalamin, so the methylated, the activated form can be very beneficial, and we want that activated form because there's actually a lot of people out there that have an MTHFR polymorphism. So this is a genetic polymorphism, which pretty much means they have a difference in their genes that causes them to not break down certain vitamins and minerals properly, so they need them to be already activated or broken down. So we want the methylcobalamin. We're looking at 500 milligrams or more. My favorite, and I do not get commission or affiliation or anything off these, but I really like Thorne Research. They do a great methylcobalamin. I take their B complex supplement. I really like that because even the folate is in the methylated form. They have science to back up their supplements. They're very well known, highly regarded company in the health industry, with a lot of research to back up their supplements and their studies, a lot of integrity there. So they're very well respected. So I do like their B complex, and I found a huge improvement. Like, I don't even notice my neuropathy anymore. I'll get tingling once in a while if my nutrition hasn't been great or I'm stressed, but compared to what it used to be, and even my clients that take just the methylcobalamin supplement alone, not the B complex, they see huge improvements, and the science is there, the studies are there. So if you are experiencing this and you also maybe know that you have an insulin issue or you have a thyroid issue or something, adding in some sort of methylcobalamin or a really good B complex. Like, when I say really good, I don't mean like your generic B complex from Jameson or something. I mean a really good. Talk to someone that knows about supplements. You're going to see improvements. You will see improvements, and not only in the connection of the neurons and the functioning, and your cerebellum functioning, which helps control movement and coordination and posture and all that. You'll also see improvements in other biomarkers as well that maybe are connected to your thyroid or your diabetes or whatever it may be. So neuropathy, this is what it is, and this is what can help it. So the tingling, the numbness, the cool, the weird sensation, maybe numbness in your lips, across your cheeks, even twitching eyes can be a sign of neuropathy as well. So adding in that supplement can quite help a lot. Okay, that's all I got on this topic. I hope you found it helpful. Take care, and we'll chat soon. Bye.